This is Greg Patterson with Arkansas AgCast, and on this edition, our guest is Dr. Amanda Perez. She's a PhD with the University of Arkansas Division of Agriculture and is an assistant professor in food systems and safeties. And welcome, Amanda.
Well, good afternoon. Glad to be with you.
Well, we've got this pandemic happening. And there's so many questions, and there's so many that are unanswered. In regards to food safety, people, I guess, they want to know, can they get COVID from food, and what kind of food safety protection do they need to take?
Yeah, it's a very important question. And, intuitively, it's really difficult to kind of think through that because of all of the messaging that we're hearing on the news. Sometimes the information that you hear can be somewhat conflicting. So I understand why people are confused by this question. But in general, based on the best available science that we have to date, it's really considered a pretty low risk of getting COVID from food or food packaging. If you are purchasing food and things like that. So food consumption, when we're talking about the consumption of food, it's very low risk that you're going to get COVID from that. A couple of reasons that could happen is COVID is transmitted, what we think it's believed to be transmitted mostly through respiratory droplets in the air. So you would be ingesting that, and that would be what would be the highest risk for exposure to COVID.
Right.
Now, that's not to say if someone who's sick were to cough or release respiratory droplets into the environment that you couldn't have that on a food contact surface. But that's where some of the general practices that we've been talking about for the 6-7 months that we've been dealing with this, hand washing and things like that. So even if you were to go in a grocery store and buy packaged food products, someone would have to have just, sneezed or coughed on that product. And then you would have to actually physically touch that, move that to your face, and somehow get it into your nasal passageways and things like that. So as long as you're wearing masks and you're not coming directly in contact with that, and you're hand washing and you're not touching your face, following those basic CDC recommendations, then you're going to be more than likely at a lower risk for that. Now, if you're going to ingest food, it's going to be transmitted through respiratory droplets rather than through your digestive tract.
So, basically you're telling me all the things, as far as food safety goes, you're saying all the things that we learned in kindergarten we need to keep doing, and all the things that the experts and medical experts are talking about, especially wearing the mask. And most grocery stores and businesses don't let you in the business without a mask on here in Arkansas. So as long as we're doing all those things, then it's a really remote chance that you're going to ingest, COVID through food. At the same time, talk about, let's say you've gone to the grocery store, you got a bunch of vegetables, fruit, all your stuff, and when you bring that into your home, any tips there that we should follow?
Definitely. So a lot of people are concerned because if you're going to buy fresh fruits and vegetables or something like that, they're sitting out at a grocery store or at a farmer's market or something like that. You'll be bringing those home. Again, we want people to follow the standard public health recommendations of making sure that you're going to be washing that food before eating it, even if you're planning to eat it raw. If you're going to be eating raw food in general, again, that is going to be going through your digestive tract rather than through your respiratory tract. And so as long as you're washing your food, washing your hands, you can still eat, fresh fruits and vegetables, and that be considered a low risk for contracting COVID.
Well, she's Dr. Amanda Perez with the University of Arkansas's Division of Agriculture. And Amanda, thank you so much. You're a food safety systems expert, and we appreciate your time here on Arkansas AgCast today. Thank you so much.
Well, thank you for having me, and everyone stay safe.